interest of time and keeping to our schedule, I have the pleasure of introducing my colleague here from the DogRisk group, Manal. Manal Hemida has a Ph.D. in animal nutrition, and she has been integral part of the DogRisk group, really, for the past 3, 4. How many years has it been?
6 years.
Wow, 6 years. Wow, time flies. In any case, she will be talking about her latest epidemiological study on tartar, of course. And I will just change this view real quick. And I'm going to hide this as well. Okay, great. Okay, thank you.
Maybe this is okay.
Okay, great. The floor is yours.
Hello. Today, we will talk about tartar in dogs and see if the diet can control the incidence or protect against tartar or not. We are usually interested in the DAMS or maternal diet and the early life diets in general. So first, let us know what is Robin, please. We would like to know what is tartar. Tartar usually happens due to bacterial accumulation in the mouth or oral cavity, and then it happens like an interaction between the bacteria and food particles and saliva and minerals. So it calcifies and ended by calculus or dental tartar. If not removed or treated good, it will extend to the gum line and cause periodontal diseases. When we looked to the epidemiology of tartar, we found in our data that the prevalence ratio is 24 ratio or percent, and it is not few. And in other literature, it was reported that it reached 30 or 63%, and it is really big ratio. And when we calculated the age of onset, we found that the average age of onset is around 3 years old. And then we looked for the risk factors or the primary risk factors. It's hidden, the top or the title is hidden, but it is primary risk factors. We found that the main risk factor is bacterial colonization in the mouth. And any other factors can lead to bacterial colonization, can end by inflammation and development of tartar. And diet, of course, is a main factor, can affect the oral microbiota or the microenvironment, which can favor or suppress the growth of bacteria, which is responsible for the development of plaque. And also the diet can keep the oral tissue intact and can control the saliva production and can keep the surface of the teeth clean if it is of rough consistency, like meat and bone meals. Also for the breeds, we found that the brachycephalic breeds is more prone, but in our data, we still will do deep investigation for that. Also, the immunity can affect the infection or the infestation with parasite. So we found that the immune compromised animals are more prone to be infected and develop tartar. Also, the age associated with tartar, as more adult age, as more tartar. Also, the chewing behavior can help to clean the surface of the teeth. So the physical activity of the dog or going outside and chewing some sticks and stones can cause cleaning of the teeth and protect against tartar. So based on that literature and in the view of the rule of the diet, we are interested to test the effect of the early diet on the incidence of later tartar in adult dogs. Because we believe in the interaction between the early diet and immune system, and which result later in teaching the immune system to be protected or susceptible to the chronic inflammatory diseases. So we ran a cross-sectional longitudinal study. We nearly covered exposure along 20 months of old or of the age of the dog to test the early life exposures, including diet and environmental exposures and maternal exposures and some domestic variables with the later onset of tartar in adult dogs, we recruited a population of more than 2 years old tartar so we can avoid the reverse casualty. Then the source of the data is from the DogRisk questionnaire. We have nearly more than 16,000, and after cleaning of the data, we have nearly more than 10,000. And then the major including or exclusion criteria for the study population or the study sample was that we selected only the owners who answered the question of the dependent variable if the dog have tartar or not. So we found that we have nearly more than 10,000 owners answered the question. And then we avoided the reverse casualty that the dog has a disease and has the exposure at the same time, so it might affect the diagnosis. So we just included in the study cases for more than 10 years. And for the controls, we take the healthy animals or animals without tartar more than 4 years of age. Due to the age of onset was around 3 years, so we just started at 4 years to be sure that the control dogs will not got tartar later. At the end, we have a good number, around for 71 dogs, nearly 50-50 between cases and controls. And for the study timeline, as we mentioned before, we nearly covered exposure along 20 months of the dog's age. And we started by the pregnancy or the conception. And during this period, the dog nearly affected by the maternal factors intrauterine. So we tested the maternal diet during the pregnancy and other immune-related variables relating to the dam. And at the time of birth, the newborn started to take its nutrition mainly from the dam through milk and affected by the domestic variables like season of birth and presence of other animals and these other contacts. So we tested maternal and environmental factors during these 3 weeks to 1 month of age. And after that, the puppy started to eat its first solid diet and contact with the surrounding environment, learn how to walk, go outside. So we tested the first solid diet of the body and other environmental factors. During the period of the puppyhood from 2 to 6 months age, we tested the puppy diet, and the puppy now can eat 100 meal solid food and other environmental factors which can affect the immunity of the dog and susceptibility to diseases. After that, we included the growth or young period and tested the young diet, and several environmental factors can affect the young dog or adolescent dog nutrition, and this extended to 1 year of age and to 1.5 years in some breeds, which extend to 18 months till pre-adolescent. And then we have some transit period and started to collect the cases at the age of 2 years and more, as we mentioned before, to avoid the reverse casualty. And then we started to collect the control dogs at the age of 4 years or more to avoid getting tartar later in life. And in addition to that, we tested some variables, genetic and demographic variables or lifestyle related, like if the mother have tartar or not, which is maternal history. And we have no information about parental history. So we test only maternal and the age and breed and gender and the type of dog, if it is a domestic dog or hunting dog or active dog. And we did the statistics using the SPSS program. We first do quantitative screening for 30 variables to cover all diet and environment and all factors which might be associated with tartar. using the cross-tabulation analysis. After that, we found nearly 20 variables with p-value less than 0.2. All of these included into the logistic regression analysis. We divided these 20 variables into 6 models according to the period of exposure. The first model only included the non-modifiable variables like genetic ones and demographic, and the other 5 models covered the 5 models of life stages, starting from prenatal, neonatal, early pup, or early postnatal, late postnatal, and young model. And the gender was used for adjustment of all the models, and the p-value was considered at less than 0.05, and the fitness of the models was tested with the recommended test analysis. And then for the quantitative estimation of the association, we found that the maternal history associated and type of dog associated and also age. But for breed and gender, we couldn't find any association. And later for the maternal variables, prenatal, we tested the maternal diet, and if the mother was dewormed or vaccinated, we found some kind of association with the maternal diet during the pregnancy, and the same was for the maternal diet during lactation. We found also association, but not significant. And after that, we tested the early puppyhood exposures, and we found the puppy diet associated, and we found the outdoor activity also associated, and sunlight exposure associated, and the kind of floor used by the early puppy also associated. And later, we tested the exposures during the period from 2 to 6 months for the adult puppy. We found the puppy diet also associated, outdoor activity, sunlight exposure, type of floor used, if it is dirt or not, all were associated with tartar. And then we tested the adolescent period, and we found the young diet associated. We found the frequency of feed intake associated, if the dog eat once or twice or have the food always available. And we tested how is the dog free, if it is free or with leash. And we tested living with other dogs or living with other animals, if it can affect the dog immunity or not. And we also tested the type of housing, and we tested the degree of home cleaning, and all are associated. And then we do the final analysis for the multivariate logistic regression analysis. Based on that, we can see the degree of risk, how it is protective, and how the risk fold increase. For the first model, we found that maternal history of tartar was a great risk if the mother was having tartar. So it has a possibility to develop tartar for or in the newborn 7 times more than if the mother don't have or doesn't have tartar. And the opposite is true. And dog age also associate. And it's known that tartar age develop at older ages. And in model 2, in which we tested prenatal variables, we just found association with the food or maternal diet. Even it's not significant, but we can see here the dry food can increase the risk 1.3 times more than the raw food, and raw food can decrease the development of tartar in the newborn later in its life by 0.7 times than the mothers on dry food. And also here in the neonatal model, we tested maternal diet during lactation. Also, it is not significant, but we can see also the risk here. The dry food can increase the risk 1.3 times compared to raw food, and raw food can decrease the risk of 0.7 times compared to dry food. It's concerning the maternal diet. And later, when we tested the first solid diet or the early puppyhood period, which extend to 1 month of age, during which the puppy start to learn how to eat, we found that a trend of association between the puppy's first solid diet and the incidence of tartar later. We found that the raw food is protective. It reduced the risk 0.6 times when compared to puppies started to eat dry food as their first diet. And dry food increased the risk 1.6 times more than raw food if it was its first solid diet. Then we found that the frequency of outdoor activity, as less going outside few times per month, as more risk 2 times, 0.4, more than going outside many times per day. And also when we tested the exposures during the late postnatal or the period from 2 to 6 months of age, we found the puppy diet is highly significant as the raw food reduced the risk 0.5 times compared to dry food, and dry food increased the risk 1.8 times compared to raw food. And also here, we found outdoor activity was also significant. So going outside more than 2 hours per day and from half at 1 hour every day compared to less than 30 minutes, it was highly, it's opposite here. Okay, it's here risk, maybe because of extra chewing or taking any solid objects. Then in the adolescent model or young or growing period from 6 months to 1 year and sometimes extend to 1.5 years, we found the young diet, even we included in the model here around 7 variables, significant 7 variables. We found that the young diet is still associated strongly with the incidence of tartar later in life. We found raw food reducing the risk 0.6 times compared to dry, and dry food increasing the risk 1.6 times compared to raw. And also we found that living with other dogs is protective, and rearing or raising alone without other dogs increasing the risk 1.5 times more than living with other dogs. So we can say our conclusion that the beneficial role of the natural diet or the wild canine diet is already reported a long time ago, since 1947. And we found the same here in our study, that the consumption of raw food early in life can help to modulate the oral microbiota and keep the balance of the good diversity. So it suppresses the bacterial overgrowth and retard the plaque formation by teaching the immune system to protect itself. So raw food in early life reduce the development of tartar. And also we found that 2 environmental factors are protective: frequency of going outdoor during early life and living with other dogs are protective, and history of tartar in the dams is a great risk factor, and also the age is a risk factor, as more older, as more chance to develop tartar. And this is a short study. Thank you.